So I'd like to talk about what's happened since September 11th. And I know you've been centrally involved with caring for FDNY personnel, for studying them, to describe what's happened to them. And we'll get into some of the details about the diseases, because I think there'll be interest in that. But if you could give kind of a big picture since that day, how many firefighters and EMS personnel have died because of WTC-related illnesses? How many have been forced into retirement by disability due to WTC illnesses? Do you have some approximate numbers that you can help us with?
Right. The magnitude keeps climbing, unfortunately. This is what happens when you're dealing with illnesses rather than injuries. So we've had nearly 150 firefighters and EMS workers die since 9/11 of World Trade Center related diseases, primarily cancer and severe respiratory diseases. We had 2 firefighters who survived long enough to get a lung transplant, but ultimately succumbed several years later. But we gave them some extra years, and their families are grateful for that. Extra time to say goodbye, to enjoy some of the formative years of their children growing up. About 200 of the 1,400 people who have come down with cancer, about 200 of them are early diagnoses because of this program. That we believe will ultimately yield survival. So retirement has impacted hugely on this workforce. Over 6,000 people have retired since 9/11. 2,000 of those people have retired due to World Trade Center related illnesses causing a disability.
Roughly what proportion have had at least one respiratory problem?
Right.
And roughly what proportion have had at least one mental health problem, which is usually depression or PTSD?
Right. So we have 5,600 who have had a World Trade Center related lung problem that reached a level of severity enough to be certified by the federal government as World Trade Center related. We have 5,600 with an upper respiratory problem involving sinuses, vocal cords, and we have nearly 50% having multiple issues related to the World Trade Center cough syndrome, which would be cough, asthma, bronchitis, chronic rhinosinusitis, acid reflux. In terms of mental health issues, we have nearly 2,000 firefighters or EMS workers that have been certified as having either PTSD and nearly 1,500 now certified with having chronic depression. And the comorbidity here is huge. 90% of the patients with post-traumatic stress disorder are now suffering from chronic depression. 56% of the patients with lower respiratory diseases are suffering from either PTSD or chronic depression. So a lot of people, not only with multiple physical health problems, but with multiple physical health and mental health problems.
So, it strikes me as really a very strong rationale for a dedicated health program staffed by people who really know the issues, know the context of the health issues that people have, and that's the kind of program you've established over the past 15 years. And I think it would be helpful if you could describe how your health program operates in general, both the clinical care side of it, but also as it ties into research.
Yeah, we had annual monitoring forever in the New York City Fire Department. I say forever, I mean years before I came here in 1986, they had an annual monitoring program. And it certainly was a very robust program at the time. It included a chest x-ray, it included standard blood tests, and it included a physician examination. With 9/11, we knew we would have to expand our program, that we'd have to add a lot of questions specific to World Trade Center related illnesses, that we'd have to expand our testing capability, But what we also knew is that over time, people retire. And if we didn't have a way to continue to offer these services to the retirees, we would be missing the boat. We would be missing what actually happens to them medically. But even more important, we wouldn't be fulfilling our obligation to every one of these firefighters and EMS workers, which is that they ran in when everybody else was running out, and now we need to be here for them. And that's been the really positive benefit of the federal funding we've received, because the city was willing to fund the active firefighters in terms of their medical monitoring and treatment, because they always did, and that was their responsibility. But there was no dollars to expand this to retirees. With the federal funding, we've been able to continue to monitor and treat the retirees. And then in 2006, we got even additional funding so that we could provide free medications, which totally changed the quality of our healthcare program, and I believe the quality of their lives.